Okay, welcome everyone to our Nursing Now Challenge event, to our Global Solutions Initiative. We are delighted to bring this innovative and exciting challenge to you that has meant collaboration and partnership with our existing Nursing Now Challenge members who are joining us today, some of them, but also a colleague from the World Health Organization in Geneva. I will introduce you to them in a moment, but first I would like to welcome you. Thank you for taking the time to join us. If you are joining us for the first time, this is your first event, I hope you will enjoy it. For those of you who have been with us before, hopefully you know what to expect. And our Global Solutions Initiatives are a real key feature of the Nursing Now Challenge. They have produced significant innovations, engagement from our members, and some great global solutions over the last few years. And today, I think we are really moving forward with something that is very current, something that is hugely important to us all, and something that we really do want to build on. We want to give you the voice, we want to give you the skills, the toolkit, we want to give you the confidence to really take what you're going to learn today and in the next two webinars forward. We want really this as a call to action, actually. There are 60,000 members in our community, and if we had every single one of you do something around the pandemic accord, for example, we would really see some traction in action. The future is the youth, that is you. And today is all about you, how we can support you, give you the skills, and hopefully you will very much enjoy our session. So I know that people will be joining us from lots of different places across the world. Hannah and Faye, our wonderful colleagues from Nursing Now Challenge, are in the chat. And if you have any questions, queries, any issues, please let us know. There will be an opportunity for a Q&A at the end of the session. But I think that's all I really want to say today. Other than a little shout out, because this is Health Worker Week. So happy Health Worker Week to all of you. We are really, really supporting not just nursing and midwifery, but all our health working colleagues across the world. And we work together. We are a collective unit. We cannot work without each other, and this is as important to them as it is to us. So any of your colleagues who you know outside and within nursing and midwifery, please share this information with them. Do not just keep it. Be generous with your knowledge and share what you learned today. So a big shout out. I know that Hannah has put a toolkit in the comms that have come out from Nursing Now Challenge this week from IntraHealth. We want you to share that. Again, that provides information about how we can advocate, how we can elevate our voice and ask for change, and probably in a way demand change. But today is about how we can provide and build capacity for you, build capacity in our profession so that we can have accurate and quality content. There is so much misinformation and disinformation out there. So you prepare to be educated today, stimulated and challenged, hopefully, and hopefully you will want to be part of our Global Solutions Initiative. So I think that's enough from me. I'm just going to ask everyone who is joining us from the team here today who will be presenting just to say a quick hello, who they are, where they're from, and then we will get cracking with this wonderful hour that we have together. So Rafayat, I'm going to go to you first. You're first on my screen at the top.
Hello, everyone. My name is Rafiat Akinokun. I am a registered nurse and midwife, originally from Nigeria, and I'm currently pursuing my master's in public health at the University of Sheffield. I am also a Nursing Now Challenge immunization advocacy champion with the Nursing Now Challenge and the Sabin Vaccine Institute. It's a pleasure to be here, and I'm excited for the launch of this new initiative with the Nursing Now Challenge Global Solutions Initiative. Thank you.
Wonderful, thank you, Rafat. And then Alex, thank you so much. If you could introduce yourself.
Thank you, Aisha. Hello, everyone. My name is Alexandra Kuzmanovic. Everyone calls me Alex, so feel free to call me Alex. I'm WHO Leadership Social Media Manager. I support Dr. Tedros on his social media activities and leading on our partnerships with social media platforms. I'm really excited to be here with you today. Thank you.
Thank you so much, Alex. And Amy?
Good morning. Thank you so much. My name is Amy Staley. I'm a clinical nurse manager here in New York City, also co-chair of the Nursing Now Challengers Committee, where I empower and amplify the voices of nurses all over the globe. And I'm so excited to see so many familiar faces in the chat box. And I'm also an immunization advocacy champion with the amazing Rafayette. So thank you guys so much for joining. Super excited to be here with you.
Wonderful. And I can see our joiners are streaming in from Kenya, Uganda, Malawi, Mexico, Kuwait, the UK, Taiwan. This is wonderful, New York. And also we add special mention to Gabby Stern, who is the Director of Comms from the WHO, the big boss there. So thank you so much, Gabby, because you've been so supportive of us in moving this forward. And we also have Rita from the Lebanon. So we are truly a global community here today. So I'm going to hand over to Alex now, who will give us spend about 15 minutes talking to you about misinformation and disinformation and why it's important, what it actually means, what's the difference between it. And actually, I was asked that question by my master's students 2 weeks ago. What is the difference between misinformation and disinformation? And because I have the wonderful Alex, who has really educated me in all of this, and Gabby also, and the people at WHO, I was able to give that answer. So I think this is about us educating ourselves so that we are able to take hold of our message and amplify it, strengthen it, and advocate for change and influence. So Alex, over to you. Thank you so much.
Thank you so much, Aisha. Again, I'm really happy to be here. And before I start, I do want to wish to all of you happy Health Worker Week. Thank you for all you are doing for all of us, patients and non-health professionals. Today, I'll focus on as Aisha mentioned, on explaining some differences between misinformation and disinformation, but also the importance of building and maintaining trust and how we can do that in this era of disinformation that we are living in. In COVID, everything has been about trust, or about who do we trust? Do we trust a public health institution or any public institution, government, or do we trust more individuals around us who may not be the experts on which vaccine we should take, which medication we should use, or which measure we should put in place to protect ourselves? So we really we've seen or witnessed that division in trust. And as COVID resulted in enormous loss of life and livelihoods, it also resulted in enormous loss and erosion of trust that we are now facing as a challenge, how to rebuild or how to maintain among those communities where we are still trusted as health professionals or health leaders. But this is where the nurses come in as a very important actor, because nurses are the most trusted health voice, or among the most trusted health voices. I found a study from Gallup that was done in November last year, where by far nurses are the most trusted by population in the US, over 80%, while doctors and other health professionals are way below. And this is why we do want to work with you more to help you be the more louder voices on social media or other channels where you feel comfortable communicating with communities where you serve. Moving to misinformation, here is one of the example, and I wanted to share this example because it's not necessarily always hate and outrage content that we are seeing. The tone can be different, and this is where the challenge comes with different content, different type of disinformation agendas behind it, and how do we really respond to that in such a lively environment and fast environment. I do want to stress that this is not the new problem. It has always been faced, especially when there is a new pathogen that evolves. It creates, when the situation is unknown, it creates fear, and then it creates space for rumors to spread, as we've seen early on in COVID. It is the big difference is that this was the first pandemic in the digital era, and as much as digital channels helped us to stay in touch with each other and go through this horrible 4 years of the pandemic, it has also helped for misinformation, it is an enabler for mis and disinformation to spread. In terms of the trend between mis and disinformation, we've seen early on in the pandemic that it was a lot about how the misinformation about how the virus spreads, how you can prevent it, how you can treat it. And then as we were moving on in different stages of the pandemic with vaccines, lockdowns, that's where the space for disinformation has been created and for different false narratives to be promoted. And we are seeing that evolving even more now with the pandemic accord, where what I will explain a bit more. But as Aisha mentioned, a lot of students or health professionals are interested to understand the difference between mis and disinformation. So misinformation is incorrect content and misleading information, which is not created with an intention to create harm. As I said, for example, we had early on in a pandemic that I will give example, garlic can treat you from COVID, and it was spread widely. And this information wasn't spread to create harm, but rather out of fear and among people to share what they are hearing somewhere from their trusted voices further into their communities and out of interest to protect their loved ones. On the other hand, when someone, and especially high-level person, says you should drink bleach, that's a bit of a different statement and narrative. So that leads me to explaining what disinformation is. It is a deliberate, false, inaccurate content that is designed to mislead people or deceive in their own narratives. And you've seen probably a lot of the content about microchips, government control, and in the current narrative of the pandemic accord, we see a lot of disinformation, how the World Health Organization wants to take over the world, to create a global government, how WHO wants power to impose lockdowns, vaccine mandates, etc. Honestly, probably the challenge there is that a lot of people do not understand the governance of WHO, but with this disinformation, they give us way more power than we actually have. But that doesn't help because these narratives are spreading widely. So maybe in one more illustration, misinformation can be an innocent mistake, but it's still dangerous. Because it's at the end of the day can also mislead people not to protect themselves in a right way or to misunderstand how a virus spreads. And on the other side, with disinformation, when it's incepted, a lot of people who are not familiar on how to understand or how to fact check the content, then again, naively, they may be spreading that further in their communities and helping someone's agenda to advance further. Here is a nice visual that our colleagues produced early on in the pandemic, but it's still relevant, how the information and including mis and disinformation spreads fast, and especially if it's sensational, it spreads even faster. But then as well, how we, as each of us, have a role to play in stopping that chain of misinformation spreading. So if each of us in our own community tries to communicate more, or when we come across something, check the source, fact check the content, we can be the person that that stops this spread going further. And this is another reason why we are here today. Moving to the Pandemic Accord Challenge, that is the main topic of today's and this challenge conversation. Maybe first to explain what the Pandemic Accord is for those who haven't heard about it yet. It is a legally binding instrument that is being negotiated by our member states. And the main objective of this instrument is to build on lessons learned from COVID to prevent that scale of suffering next time a new pathogen or a next pandemic happens. But at the core is to really address inequities that we faced. And that is by enabling sharing of information, pathogens, technologies, medical tools. And this is where the main tensions are at the moment in between negotiators of the North and the South, or developed and developing countries. And also the instrument has objective to foster trust between member states, between the stakeholders, and also closer collaboration. Again, not just among member states, but others, private sector, civil society, and communities, as all hands need to be on deck to deal with such a global crisis. When it comes to Pandemic Accord disinformation, as I mentioned, the main narratives are about WHO making this a power grab, and also how we want to be empowered to impose countries what they have to do, which is absolutely not possible, and it's even clearly stated now in the accord. And Aisha has been a champion who has been also clarifying and answering some of those false narratives on social media. Where are the drivers of this disinformation when it comes to a Pandemic Accord? There are automated drivers. Algorithms are curating sensational content and engaging content, and this is a challenge because when we communicate some of those very complex processes or very scientific technical information, it is very hard to be sensational. Also, it is not our job to be sensational. Our job is to provide accurate information. We do our best to tailor information that is appealing and understandable to different audiences, but it's still, when you take something out of context, make it sensational, it is way easier for the algorithm to pick it up. There are also bots. There are also now AI threats, especially that on this topic, there's a lot more disinformation and bad content, so to say. That's where the AI pulls out its own sources of information. This is why we also need more of good players in the ecosystem, so that if there is also AI use, there can be pull out of good content. When it comes to non-automated drivers, we have state actors, mostly conservatives and right-wing politicians, and we have non-state actors, conspiracy theorists, anti-vaxxers, COVID skepticism, etc. And also, I want to flag that a lot of those people who are anti-pandemic accord, they are already in those groups of anti-globalists, anti-multilateralism, etc. It's not that necessarily these are new people joining the movement. They already have some different strong beliefs. There are also psychological drivers, personal biases, also cognitive laziness to double check and fact check the content. And this is where those who drive those narratives are playing on, because they know that they don't care about the facts. They're actually just using every our facts to jump on and drive their narratives. And also there are some desires to be safe and, control the environment and deny certain threats. Again, I just want to stress the role of the social media algorithms here. And when we have content that is exciting, sensational, and it starts getting more engagement, this is how the algorithm as well functions. They are not designed for information sharing. They are designed for engagement. This is how certain content, here are examples, and one from the Wide Awake Media is from 2 days ago, and you can see there is like over 7,000 retweets 14,000 likes. It's a huge engagement, and we don't see this level engagement on factual content when it comes to pandemic accord. I don't think we've seen any content having a viral effect. Unfortunately, there's a lot of toxic, outrageous, extreme narrative tone in this type of content, and also the actors are a lot repeating their sensational messages, which results then in those who are exposed to it to make it seem as inaccurate because they are surrounded by it a lot, seeing it so many times being repeated. So these are examples. We'll share the slides so you can, this from Russell Brown. And we had actually a response to this from our legal principal, Steve Solomon. We can share that afterwards as well. And as mentioned before, the main mantra is of those who are spreading the pandemic accord disinformation narrative is the inclusion of the accord in the overall discourse of Great Reset, polarization, and also it has helped for those narratives to withdraw from WHO among the conservative right-wing politicians. The type of narrative that they are using is very toxic language, but very also simplistic. The tactics are to appeal to emotions such as fear and anger. They use a lot of video content that has that viral potential. And as I mentioned, spreading targeted content over time again and again to build trust and credibility in the narrative. Overall trends when we see this content spreading more is often during election periods, when there are some calls made in parliaments, and when the WHO meetings or negotiations are happening, like when the international negotiating bodies are meeting, where we see that this disinformation spread the most is in North and South America, Europe, Australia. English language is really predominant in the narrative. However, we also do have champions that Nursing Now and Aisha have been part of in spreading the facts and explanation why we need the pandemic accord. But we also have youth voices, and on the screen are a few examples through the WHO Youth Council and other networks of universities and health students, civil society, NGOs, other UN partners, activists, medical health workers, journalists. We do have some politicians and former head of government, like Gordon Brown, who have been really strong in their voices and advocating for the pandemic accord. Of course, academics and other health experts. And as it's not where we live now with all of this, it's not a matter of what is true that counts, but a matter of what is perceived to be true. And that brings me to the importance and power of truth tellers and what we've done during COVID in this regard. And I hope that Dr. Mike Ryan and Dr. Maria Van Kerkhove can be the champions and motivation for other health professionals to be voices out there who communicate about health science and health accurate content. It comes with a price. That the more visible they were becoming in the COVID, they were receiving more and more attacks. So we do need to acknowledge that being out there and getting out into those conversations pose a threat. And if any of you of us ever feel that it is too much and has impact on one's mental health, it's not worth it. We need to protect ourselves and our health. But for those who can and want to be part of the fight, so to say, it is really important that we have more health champions out there. And it is really different when a health expert is out there in the debate and explaining health matters than someone like me who is a communication expert. I can communicate the messages of my colleagues and what the WHO or other health experts are saying, but I cannot be the person who enters the debate and explaining why certain things are mis or disinformation, as I don't have deep enough knowledge on the matter. I can debate social media or communication matters. But you as nurses and health professionals have that knowledge that you can use to be part of the conversation. It is also important to be present in a consistent way. It is important to be present in authentic way. It is not just, oh, this is wrong and I'm going to fact check it. It's part of building your own voice and your own presence. Maria very successfully built her presence on Twitter or X. For a scientific community, for the content that hasn't been so appropriate to be posted on WHO channels, that is too technical, Maria would be posting that. New scientific briefs, new situation reports, explaining the trends, explaining the scientific development. And she is the person that media are quoting, her tweets are being quoted, that other scientific community members are looking up to and quoting. On the other hand, we also built the live content feature that we were doing regularly on the weekly basis with Mike and Maria, where we would take questions through comments from our viewers, from the public, and they would be then explaining those matters. And it's way easier than in a short video format. We would do some repurposing after the live and cut the key questions. But we really had several master classes, I must say, with Dr. Mike Ryan explaining us how medicine or how public health work, and that really helped us to build trust with the communities that are following us on social media. Besides technical or public health experts, we also need leadership, and Dr. Tedros is someone who does understand the power of social media in communicating what we do. His tone is a bit different. He is more political and he addresses political matters. He does communicate WHO work and science, our operational activities. And he is also trying to be more personal, to give that personal tone to what, and personal face to what WHO does. And I'm sharing this again in the light of that it's important that whoever builds social media profile and visibility, it has to be comprehensive, and you need to bring in a bit of your personality and authenticity in order to really have effect. We've also seen during this time to engage with different youth actors, civil society, etc. There was a lot of people who started being present on social media now, trying to debunk this information around the accord, but it's not having as much effect because it takes also time and consistency to build a presence so that it's effective then. But if you haven't started yet, the best time to start is now. And on that, I would like to end on this note, that we should never consider ourselves a finished product, not just as nurses, but as professionals or individuals in any aspect, and that we need to continue learning and adapt it to challenges that we are faced to. And I hope together we can help each other to provide people with more quality health content and prevent more harm from mis and disinformation. Thank you, and I hope to stay in touch, and I'm happy to answer your questions later.
Absolutely wonderful, wonderful, wonderful. Alex, thank you for a very comprehensive, lots of lovely applause there coming up on the screen, which is so beautiful, and lots of fantastic feedback for you. Thank you for your amazing presentation, lots of chat, and I think an outpouring of gratitude for your generosity in taking the time to educate us, to support us, and give us that encouragement that we need as nurses. We find that often we are forgotten, and sometimes our contribution is seen in a very different way. And the thing is, nursing is about the art and the science, and as well as being caring and having that art, we are scientists also, and we have a voice, and this is wonderful. We want to be educated. We want to understand how we can get that message across, because we do it day to day. It's naturally, it's innate in us. We don't even see it as being anything special, but actually we have got something to say. And our Nursing Now challenge community has definitely got something to say. And just to remind everyone, this is being recorded, so you will be able to use it, and it will be available on YouTube. There will be an opportunity for questions and answers at the end. Hannah will also put in links to various things, and thank you so much, Alex, because you've managed to condense the key elements and the take-home messages, the power of truth tellers. And that's nursing, isn't it? That's all health workers. We are truth tellers, and thinking about your authenticity, building your presence, your consistency in that, not overnight, but as a person, and the thing that anchors your moral compass moving forward. As a nurse, what is it we want to do for ourselves as our profession, but also for our community, global health, population health? This is the first part of us being able to be educated and given the toolkit to do that. So this leads most wonderfully on to an example in our community of two amazing nurses who have done just that recently during the pandemic. And we saw the wonderful conversations that Alex had in these images with Mike and Maria, who for me were just the anchor point also during COVID, because that was where I felt I could get the authenticity and the real information. And we have that in Rafayat and Amy, who are going to give us their experience from the field, how they actually did something similar to this, using their influence to debunk myths around the COVID vaccine. And they did this this was a collaborative with the Sabin Institute, and we ran a Global Solutions Initiative. There were a number of nurses involved in this as part of COVID-19 vaccination. So they are going to tell us over the next 10 minutes what it was like for them. And hopefully that will help you see how this can actually happen. And we'll tell you afterwards what it is we specifically are asking of you for this specific challenge. So Amy and Rafayat, over to you. Thank you so much again, Alex.
Yeah, thank you so much. On February 2nd this year, I celebrated 5 years as a proud registered nurse. Next week, on April 8th, the moon will cover the sun, creating this ring of fire in the darkness as a total solar eclipse shifts our entire universe, and I will celebrate another 365 days existing in it. During the height of the COVID-19 pandemic, however, I was a bedside nurse deployed to care for some of the sickest patients in New York City and Florida. Although it's been approximately 1,480 days since this pandemic started, the feeling of my profession shifting that occurred on March 13th, 2020 is one that I'll somehow remember for eternity. At the time, I thought of this period as just another chapter. However, as cases, frustration, and mistrust grew, I realized that this pandemic was no longer a chapter in the book of nursing. It somehow became a narrative where healthcare workers like myself and Rafayat were no longer the authors. Misinformation spread throughout my community faster than the virus itself as I watched from the inside of an isolation room, double masked, wishing to tell the stories of the hospital walls that protected me. The truth behind the science that was coming to light during this dark time. In the depths of the internet, fear and misinformation spread like wildfire, specifically in low-income communities like my own. I couldn't change what was being illustrated in history, but I could shed light on the science actively being discovered, shifting this pandemic. I was named an immunization advocacy champion by Nursing Now, and with a few tools from the storytellers at People Power Health and the Sabin Vaccine Institute, my voice traveled throughout 150 countries. I utilized the funding that had been awarded to me to benefit low-income communities throughout New York City who did not have access to COVID-19 vaccine information, and all of a sudden, I was no longer just advocating for my patients at the bedside. I was on the sidelines of the 77th United Nations General Assembly, sparking up conversation in a room where I always knew nurses belonged. I just never knew that nurse would be me. I continue to advocate for vaccine equity in countries where my colleagues were traveling by foot, by horse, by any means necessary to protect their communities. You see, nurses like Rafayette are not just a page in this pandemic, they're the entire book, protected by the binding and support from organizations like Nursing Now and the WHO. The voice and impact of a nurse is worth far more than the billions flowing throughout healthcare systems all around the world. Who more powerful than the most powerful and trusted profession of 28 million to halt the spread of misinformation? I know that not every day may feel like a celebration, and some days may feel darker than the alignment of a solar eclipse casting a massive shadow over Earth in the middle of the day. But how incredible that everything could align in such a way. You and I have the privilege of lighting a few candles and singing a silly little song every 365 days because of nurses and midwives who deliver, care, heal, advocate, educate. Nurses bridge the gap between science and hope. And when I hear Tedros and Aisha and Alex talk about this pandemic accord, I think of a nurse who was brave enough to speak up, double masked, isolated in a place where hope had yet to ignite, opportunity had yet to rise, science had yet to be uncovered, and the possibility of living in a new way had yet to exist. The opportunity to uncover our truth begins with the pandemic accord, a script thoughtfully narrated by science, global leaders, and the unstoppable force of healthcare workers. Addressing misinformation is not a burden, it's an obligation. And if the earth can shift in such a unique and magnificent way, we too can shift the narrative with the pandemic accord. So with that, I'll pass it over to the amazing Rafayette, my colleague that I'm so proud to work with, and I really look forward to seeing the impacts that you guys have on your communities and globally as a whole. Thanks.
Thank you so much, Amy. You were able to really talk about our experiences as National Challenge Immunization Advocacy Champions, and I am such a proud colleague of yours. So during the COVID-19 pandemic, I worked as a public health nurse in a district, rural district at Sobi, Ilorin, Southwest Nigeria. There I was facilitating routine immunization, and I also was in charge of providing maternal and family planning services. So a month after the COVID-19 lockdown, there was a seemingly lower level of immunization, vaccination, and then at the time, the most plausible explanation was that people were finding it difficult to adjust to routine immunization schedule after the lockdown. However, this explanation was challenged after I had a personal conversation with a mother who came in for contraception insertion. In our words, people are saying that COVID-19 this came to reduce our population and kill us because I don't trust how fast they could come up with the COVID-19 vaccine, just how fast it could. This gave a clearer vision of the impact of misinformation within the community, and in fact, how fast it could spread to not just COVID-19 vaccination, but to routine immunizations, which at the time were really going low. And during the COVID-19 pandemic, I realized that despite the massive immunization campaigns that was on the radio, on the TV stations in Nigeria, there was still a massive growth of misinformation. I started thinking of the ways to tackle this challenge in my community. So the first thing I thought was to recognize the fact that the woman who was able to talked to me because she trusted me. And I started talking to people in the community during their normal daily activities. I understood that people need to feel listened to, and in fact, the fact that they trusted me within their care, I was able to get in contact with them, and then they were able to talk to me about their challenges. So in tackling this, I decided to use the storytelling tool that I was equipped with as an immunization advocacy champion, and I decided to communicate to them in local languages that they could understand. My story was not just about the story of, talking to people. It was about the story that conveyed hope. It was the story that made people feel listened to. It was a story that made people feel supported. So I went into the local market together with my colleagues to talk to people in their local setting about the story of how I have personally taken the vaccine and how I have supported countless families with children to overcome the burden of vaccine-preventable diseases. It also included the opportunity to talk to people in local languages that they understood while acknowledging their fears and helping to overcome them. At the end of my activity, I was able to convince and follow up with 50 people to take the vaccine within 6 weeks. And with my experience, I was made to understand the incredible power that nurses have within the community, because there are so many healthcare decisions that are taken in the community. And if we have to develop changes within ourselves, then those changes should begin in the communities as well. So I started following up with the 50 people, and there were an incredible increase in the number of people who came up with to take the vaccine, because of course, just like misinformation spreads, good information spreads as well. So it is important that we as nurses remain not just the most trusted healthcare professionals, but also we should be the most influential in assisting people to make the best health decisions that they can. I believe that nurses have so much power to change the world, and we all as healthcare professionals should work together and unite together to ensure that we make the world a better place to live. Thank you.
Wonderful. Just wonderful. Two amazing presentations, talks, narratives, reflections. Just joyful to listen to you both, and so eloquently describe your experiences and also outline the importance of our profession and all health workers and the joy of the work that we do and the change that we can be, and also the power of storytelling. And for those of you who, I don't know if I've got any of my students on this call, but we do cover the work of Marshall Gans in my class, and the story of us, the story of now, and the power of storytelling in bringing people together and creating that social movement. And that's what we need to do. And Amy, you said, who better than 28 million nurses? If we spoke, then leaders would not be able to ignore us. And this whole purpose of today is ensuring and galvanizing and trying to elevate you to a position that you can speak and be heard. So thank you so much, Amy and Rafayette. And I think there's something I was saying this week to my students was, if you want to see what your career or where you're going to be in 5 years' time, you need to look at what you're saying and doing now. And I think that is what today is about. What are you doing and saying now? It's about this idea and topic of what we can do to address things like the pandemic accord, to look at vaccine inequity, to look at misinformation and disinformation, to look at how we can be the carriers of accurate information, so that we can address the inequality, so that we can hold governments to account. And as a civil society and as businesses, as Alex said, this is not just about health. This is about our whole society. And nurses are everywhere in our society. That is why we really are a great vehicle to go out there with this information. So we've heard from Alex, which is wonderful. And we have now heard from the wonderful Amy and Rafayette. And we're going to move now to the ask of you all. What is it that we are asking you to do? What is the challenge? How can you actively engage? How can you have your voice heard? How can you tackle this misinformation and disinformation? And this is the first of 3 webinars that we will have. And I'll tell you a little bit more about those later. So this is a very specific challenge to you. How would you use your voice around the pandemic accord, or perhaps another issue that is of interest to you? And how would you develop a social media activity and use that to amplify your voice in a truthful way. Now, the information, the specific information, we've created a page on the Nursing Now Challenge website. There you will find all the information you need to do this. And we will pick this up in some question and answers at the end of the session. We finish at 11 o'clock, so we've got a little bit of time left to do that. But that's what we want you to do. We are handing the power to you. And what we don't want is something really big and complicated, etc. Hannah's just put the link in the chat. But what we want is something memorable, something impactful, something truthful, something that could be used by others. And we've seen young nurses and early career nurses be so innovative. You are in an era where you've grown up with technology. What we want to do is help you utilize it for the greater good, for the common good. So you don't need huge amount of technology yourself. You don't need very specific expertise. We will give you some of that later on, but you've probably got ideas. And we are thinking about the winner. Oh, I'm just about to get to the prize. Yes. So the amazing opportunity at the end of this for the prize winner will be the chance to pitch your idea, your concept note to Alex and hopefully maybe Gabby and Paul. I mean, this is wonderful. These are colleagues who are at the very top of their game. They are in WHO, they are driving forward the change we want to see. They are the change makers. They are the people that we look to for inspiration. So they will listen to you and hear your pitch and maybe give you a little bit of feedback and some kind of insight and guidance. And that will hopefully help you take that forward to make it a reality. So it'll be an opportunity for you to maybe discuss your ideas and what a great opportunity that would be. To hear from them. So we're really excited about that. But what I want to do now is we've got sort of 13 minutes left and Alex is here, myself, Amy and Lafayette, and Hannah is in the background there with Faye. So please, if you have any questions, now is the time to ask us. The next session is on the 26th of April at 10 a.m. and that will be the workshop. And that will be literally, I'm so excited about the workshop. Because Alex is going to run that workshop. We're going to get a masterclass from her. Top tips, how-to examples, a little bit of a kind of a lecture bit at the beginning and maybe some scenarios. We're still trying to just work through that. So we'd like to hear from you also today what in the chat you would like to see, but there will be that workshop. So please spread the word. If you didn't come to this first session, tell your colleagues you can definitely come to the workshop. You don't have to have come to all of them, but we really want as many people as possible to be part of this and have that exposure. So let's see if we have got any questions, or is there anything while we're waiting on questions coming in that Alex, you wanted to pick up just from what you've heard in the last sort of 20 minutes?
Thank you very much, Aisha. I think that Amy and Rafiat were amazing and inspiring once again on what actually nurses and health workers do face in action in the field. And actually, you are the ones who pay the ultimate price of mis and disinformation when patients are not using the appropriate measures, preventative measures or treatment, etc. They don't want to get vaccinated. It comes back to you at the end of the day for the additional care. So full admiration for all that you do. This is a small part from us others in the sphere to help you. But just thinking about the next session, I would really encourage you to join us and to really invite more of your partners and members to join us. We are planning to do some practical exercise and then to have some debate and discussion on how different actors could act in tackling mis and disinformation. So it would be really important to have more people in person rather than listening later. Of course, we are all busy and have the real jobs of treating patients, I want to say, but really strong encouragement that we would like to have you on the line on 26th of April. Also, any feedback that you can provide us, any concrete ask that you would like us to address, it would be really helpful as well. So please let us know, and we will adjust our plans for next sessions based on your wishes. Thank you.
Lovely, thank you, thank you. You can, people are just asking, you can write it now in the chat, your questions, and we have a question from Nala, which is, maybe Nala, if you can just clarify that question a little more. How can communication be part of the information correction immediately? I think, is that around where we see something that is not correct, and how do we then communicate? I don't know if that's what you're maybe meaning there. It maybe follows on from, I don't know if, Alex, you actually mentioned this, or this was a different conversation I perhaps had with Hannah around how you then respond to it. And I think we're going to pick up some of that in the workshop in the 26th. So how do you respond? How would you be able to communicate that, and in what way? So we've just put up the guidelines in the challenge chat there. And there is, Alex has got her hand up.
Thank you, Aisha. Yes, I think as well it's important to have assessment as well on what do you want to what does merit your response and what doesn't merit your response, because some of those narratives, they don't really care, or like actors, they don't really care about your answer. They're just going to use the opportunity to hammer their message again. So that is the first step, that it really does matter. But there is also a part I haven't covered today, but I will talk about that next time, is when we also make a mistake, which can happen, or when we maybe don't communicate something in a clear way enough, and that creates a misunderstanding. It is really important that we also take accountability and correct ourselves, and admit we are also humans. So this is also an important part that we learned in COVID, especially, that is part of building trust and reputation. So we'll talk more about that on 26th April.
Brilliant, thank you so much. And also we have another, just while we're waiting on some questions coming in, if that's possible, we wanted to set you a little bit of a little challenge between now and the next session. And this is to, I guess, get you thinking about it, because you're probably now, having heard all this information, probably for the first time, it's got you really thinking about it. So it might be too soon for you to come up with questions, or to think, well, okay, what does that really mean for me now? And what am I going to learn in the next session? But what we thought was, perhaps what you can do is find out a little bit more about the Pandemic Accord. And I don't know if Hannah can perhaps put the 2-pager that we have in the chat, and we can put it on the website, the landing page of the website for the Global Solutions Initiative also, where we are going to put some resources. No problem, Alex. Can you please send him our best regards? Tell him we are behind him, we are supporting him, and we are doing it for him and WHO and all the colleagues there.
Thank you so much.
Okay, take care, bye. And we were thinking about identify something to do with the Pandemic Accord that has misinformation or disinformation in your online community. Where have you seen that, or where have you heard that? And start to think of possible responses to that, mindful of what Alex has just said, where sometimes we don't need to respond to everything. And I've heard Gabby say this, and I really like this. We can spend lots of time arguing against the disinformation and misinformation. And often it is better just to put the truth out there let's just keep putting the truth out there. If 28 million nurses put accurate, truthful information out there, can you imagine? We wouldn't be interested in somebody's tweet on X that had 14,000 likes or whatever. We would have 28 million nurses. So that's kind of the thing we've to think about, isn't it? But you still have to try and understand perhaps what the response would be. What would your response be? Would it be accurate information? What would that look like? So maybe start having a think about that between now and the workshop so that you're coming a little bit more prepared. You've perhaps talked it with your colleagues. That would be great. If each of you went and spoke to 5 different colleagues, then that would be wonderful. So that's what we'd like you to do. And the email that we want you to send it to is in the chat. It's challenge@nursingnow.global. If you send that, you don't have to do it. It's not a requirement, but we just thought some of you might like to, what was it Hannah said this morning, dip their toe in the water with it. So let's see if, you perhaps have that. So, Aramoki has said, I would like to ask if there is a word limit for the concept note, please. Now, Hannah might come back with that. We did talk about that this morning, Hannah and I. I don't know if we put it in there, but I think usually, certainly no more than a few pages, maybe 700 words. Hannah, I'm looking for you to come in to just confirm that. Yeah, 800 to 1,000, no more than that. Okay, so don't go, you're not, Aramoki, don't worry, you don't have to write an 80,000 thesis PhD, which is what you've just done. And what else have we got? We've got the WHO Pandemic Accord Toolkit is in the chat. Please have a look at that. And someone's put in Mexico, misinformation about COVID-19 went beyond sensationalism, which is why the population suffered many mental health problems. My question is how to have true and quick information related to our profession to help our communities. Okay, that's a very good question. And I think that maybe picks up on Nala's chat also. What is wonderful is that WHO does have, I mean, for me, that is my go-to place. I will go to WHO because I know that that information is accurate, it's truthful, and it's coming from people that are authentic and I trust. So I will always go there. I listen to their news feeds, I listen to their live broadcasts, I do that on my phone, and I just, I listen to that all the time. I look at the policy briefs they're putting out and different things. So we will look to put the 2-pager on the pandemic accord. So I think perhaps one of the things even between now and the next meeting is start thinking where your sources of truth are. Who are the truth tellers? What organizations would you trust? And what are the top 3 that are your go-to points for information? And it could be your professional bodies, etc. So I think that's a really good question. But the challenge for us is how do we get that information out there if people perhaps don't have access to it? So I can understand what you're saying, but there are resources there, and hopefully Nursing Now Challenge is one of those organisations that you would trust, and there are others. Anything else? Nala's got, I have a video that was posted in CNN. How can I share it with my documents? Nala, I would email the email that we've given you if you have got any queries around specific technical things like that, and we will get back to you on it. Okay, so we've got 2 minutes left, so I'm just going to wrap up here. We have heard from Alex. She has clarified the difference between disinformation and misinformation. She's spoken about the pandemic accord. And I mean, this is a once in a generation opportunity, the pandemic accord. I cannot stress how important it is. So please take time to have a look at that. We will put the 2-pager. It summarizes what it is in very plain language. I've been sending it out to all my colleagues at different universities and different people, and they've really enjoyed looking at that. We've talked about what's coming next, the workshop, and where we're going to cover things and skills that will be useful for you. We've heard from Amy and Rafayette what their experience has been. They've actually done it. they've gone and done this, so it's possible. And we've heard from our wonderful colleagues today. We've had a small number, but I know you will go out there and spread the word, and we really want to do that before the next one. We want to really get into the 3 figures for people attending, so please do that. It will be wonderful to have you there, and thank you so much. Any queries, get in touch with us. Have a wonderful Friday, and we will see you soon. Take care, and thank you so much. Be the person who stops the spread. We want to be the nurses who do that. Thank you all. Thank you, everyone, and well done. And please keep doing what you're doing. You're amazing, wonderful, inspiring, and let's make a difference together. Thank you so much.